One of the main ways to help control the spread of COVID-19 is now a thing of the past. Good evening. Thanks for joining us. I'm Angela Taylor.
Hey everybody, I'm Russ Bowen. Angela, we certainly heard a whole lot about contact tracing early on in the pandemic. Well, as the disease has evolved, the idea of staying ahead of the virus by reaching out to those who may have been exposed is nearly impossible now. It is still seen as a method that likely saved thousands upon thousands of lives, tracing and contacting people who came in contact with someone who had COVID-19.
Identifying those individuals that were positive, doing contact tracing was a very effective tool. And in fact, that helped us keep very low numbers, on the campus.
But that was early on, when there was a window of 5 to 7 days. But Omicron has closed that gap by 2 to 3 days, meaning by the time you're notified by a contact tracer, you're already at the height of being ill and contagious.
And the numbers are just so massive, you just can't staff that amount of people to do contact tracing.
So Duke, UNC Health, and the Orange County Health Department join others as the resources once used for contact tracing are needed elsewhere.
Trying to make sure that people who are positive have the resources that they need to know when they can come back to come out of isolation safely.
Which is now more important than contact tracing.
We can't have all of our essential workers in society sick the same week.
The Orange County Medical Director says so many people are testing positive all at once, it's straining every industry and service, from daycare and schools to grocery stores to healthcare.
Making sure that people aren't getting this infection all at once, all in the same week. We have to spread it out, even if we might not be able to stop it.
North Carolina DHHS is also shifting gears by now primarily recommending contact tracing in high priority settings like congregate living, having contact tracers call those who test positive but can't be reached by email or text. So is contact tracing as we know it for COVID-19 a permanent thing of the past? Well, it depends on what the next variant looks like and how sick it makes people.
That requires us to change policies and to adapt to that. So it can be confusing, but it's all meant to try to stay ahead of this as best we can.
Yeah, you got to change, and
It's all we're doing with this
we're all
disease.
adapting. It's hard to believe we're getting into the third year. There may be a lot of questions on what we've been spending on contact tracers. We're trying to gather all that data for you. Hopefully I'll have that for you tomorrow.
All right.